work at St. Paul's surgery unit. I find nursing to be a very rewarding career. We do not only care for patients, but we end up guiding them through some of the most vulnerable times of their lives. I enjoy the different surgeries that I see on a daily basis and how they can impact patients differently.
That includes abdominal surgeries, colorectal surgeries. Sometimes we get patients, orthopedic, gynae, plastics, and urology. I have had a very rewarding, career so far. It's been an interesting time for me working in the surgical program because it affords me the opportunity to see how the internal workings of the body, and it's very, very, very fulfilling seeing how the body works, the resiliency in going through times of vulnerability and they recover, but seeing them go through and standing with them as they make that journey from their pre-op to post-op. We care for them and they go home. It's quite an exciting opportunity. Well, we work alongside with the doctors to know exactly what surgery they're going to go through. We look at the documentation, making sure that all the consents are prepared and the patient understands what they're going in for. We also make sure that the blood work is done to make sure that everything is in place. The timing, we liaise and communicate with the patients as well so they know what is happening, what time they're going for surgery, give them information, sometimes for them and for the family as well, so that they understand exactly the timeline and what they're going in for.
From there on, we start focusing more on mobility, focusing more on diet, focusing on them getting better, because that's the hope, is to actually get them on their own and then they can leave the hospital safely.
Supporting new nurses when they come onto the ward, it's another area we take very seriously as well too, because it's an opportunity for us to prepare them as they come in. We see them as colleagues and we help them to come in, managing the anxiety and everything. And we have this body system in the ward where the new nurses are coming in and they are bodied with the experienced nurses as well. The beautiful thing is that you're not learning alone. You have the support of the senior nurses around to help you as you do that learning, and then you grow alongside as you learn too.
My best advice to a new grad, I would say, is to be kind. Being kind not only make you care for people, but end up treating people the way you like to be treated. You're gonna learn a lot, but as busy as it can be, it's so fulfilling when you see your patients at the end of the day thanking you, or it's like, oh, you're leaving right now, or are you coming back, or are you gonna be with me tonight? I find this is really amazing, even despite how busy and crazy your day was. I've always heard about the great culture here, the staff culture. It wasn't until I experienced it myself during my preceptorship. I knew then that this is the place for me, and here I am.
What I love most about my journey here in Providence is the support I have received and continue to receive, from the managers, from the clinical nurse leaders. The resources that are available, plenty, and it makes the work, a lot easy for us in planning and providing care. Very good nursing care for the patients as well too. And we have managers who support, who appreciate what we do. That has been a huge motivation for me to stay in Providence, and I hope to be here, going forward. I don't plan to going anywhere.